Hello, I'm Sharon Friel. I'm Professor of Health Equity and Director of the Planetary Health Equity Hothouse. At the Hothouse, we focus on the intersections between climate change, inequality and health, looking at governance approaches to improve planetary health equity outcomes, which we define as the equitable enjoyment of good health in a stable Earth system. Key to doing that is really addressing the global consumptogenic system. The system of actors, of institutions, of policies, of commercial activities, of norms that currently is incentivizing and rewarding the excessive production and consumption of fossil fuel goods and services. Not only are those goods and services really bad for the environment, but they're also bad for human health, and they are very unequally distributed and valued. What do we need to transform that consumptogenic system? What are the conditions that are going to enable change to happen? Big question that we ask ourselves on a daily basis at the Hothouse. So in 2025, I'd love to see much greater attention to policy and commerce that is serving planetary health equity interests. Issues of economic systems, of energy systems, of food systems, for example, getting them set up in policy and commerce in ways that benefit environment, social and health outcomes, and not just in pursuit of profit and economic growth.
Hi, I'm Amy Carrad and I double as a researcher with ARCH, the Australian Research Centre for Health Equity, and I'm also the Senior Project Officer for the Planetary Health Equity Hothouse at the ANU. My research project that I work on with Associate Professor Ashley Schramm and others is looking at the role of privilege in public policy and what that means for health equity. So we're really about breaking down and exploring the advantage that people at the top end of town have, rather than focusing on the disadvantage, as is quite common in social sciences and public health research. In my role as the project officer at the Planetary Health Equity Hothouse, I'm really working behind the scenes to get the flagship events up and running and promoted. So our flagship events are the monthly Saving the World webinar series and the annual Future Leaders program, which is a program for PhD candidates, early career researchers, and also early career professionals from civil society and government, where they come to Canberra, they come to the School of Regulation and Global Governance here with us for 2 weeks. It's a really intensive program looking at the theory, research and concepts behind planetary health equity, and also diving into communication methods. So things about masterclasses around how to communicate your research, but also in terms of verbal communication as well as writing. And it's really great 2 weeks for about 12, 15 participants each year. And they really get to bond and form connections that is really unique part of the program.
Hi, I'm Hridesh Gajurel, and I'm a research fellow here at the PHE Hothouse at the School of Regulation and Global Governance at ANU. My research focuses currently on paradigm shifts. And the reason that I'm focusing on paradigm shifts at the moment is because the current paradigm that is dominant, especially in the global north, which focuses on economic growth and especially consumption growth, in the context of the changing climate, is something that needs changing. The academic literature is problem-focused but not solution-focused, and what we're trying to do here at the Hothouse is look at solutions and how paradigm shifts and so on can be achieved. I'm also looking at food systems and comparing different countries in terms of their regulation of unhealthy foods, and also in terms of how their idea of state intervention, or what is the appropriate level of state intervention, is associated with different types of regulation of food. The goal of this research is to inform or give countries a sense of where they can be in terms of state regulation without necessarily sacrificing the kind of freedom that they value, that a liberal democracy values. For 2025, given that we are in this very chaotic era, in fact it's been quite chaotic since COVID, the two ways that it can go is that things can just get worse, and the other one is, if there's a reaction to the current chaos that's coming out, especially out of America, in a way that then ultimately leads to paradigm shifts. That is basically what we need, and so we are trying to contribute in whatever way we can towards that with the research that we do.
Hi, my name is Chelsea Hunnisett, and I'm a PhD scholar at the Planetary Health Equity Hothouse. My research is focused on Commonwealth Treasury and its ability to implement a well-being economy that achieves planetary health equity goals. My research is really interested in the institution of Commonwealth Treasury, how it comes to the policy decisions that it makes in terms of the economy, and how that will impact our health, our climate, and equity. In terms of 2025, what I'm focused on doing is gathering all my research data, interviewing people from across the government, current politicians, former politicians, current bureaucrats, former bureaucrats, civil society, law experts, regulation experts, to really get a sense of how Commonwealth Treasury works, how it undertakes the work that it does, what influences it to undertake different policy work.
Hello, I'm Gio, one of the PhD students at the Planetary Health Equity Hothouse. My research really focused on philanthropic organizations and where they put their money in research. Well, because philanthropic organizations, especially in the last 30 years, have been putting a lot of money in research and the generation of evidence. And this is important because a lot of international organizations, governments are using evidence to develop policy that have broader than repercussion for society. What kind of money and how much money we put in research or we don't put in certain type of research obviously have bigger repercussion for planetary health, health equity, and what we call planetary health equity. So my take for 2025 is really about reflecting on what's happening in the world at the moment when it comes to funding for research. We have seen, for example, with the US pulling out money from universities, and this really creates the space for private actors like philanthropic organizations to step in. And I think I would like to invite universities and colleagues all around the world to reflect what this means for research and not just welcome this, money that are coming that obviously helps research, but really think what the repercussion of this is for us as researchers.
Hi, my name is Roxana Tompea, and I'm a PhD scholar at the Planetary Health Equity Hothouse. My research explores green claims, green foods, and greenwashing. And if I were to define greenwashing using one word, it would be deception. Whether it's intentional or inadvertent, greenwashing robs us 3 times. First, of the actual truth. Second, of genuinely green products and services by keeping deceptive companies in position of power. And third, it robs us of our ability to build a better future. In a time where marketing and advertising are outpacing authenticity, the slogan of being green should also become a philosophy and should be followed by a genuine commitment to environmental and social responsibility. This responsibility is also at the core of my research, where I'm looking into how we can shift it from the consumer side, caveat emptor, buyer beware, into the producer side, caveat venditor, seller beware. In other words, it's about corporations and not consumers, the ones that are responsible for the actual claims they make about sustainability. This matters today more than ever, as we see many companies investing in an image of greenness without actually being green. And we see products marketed as being sustainable, often at a premium price, even though they're damaging the environment, oftentimes also at the expense of human health and equity. We have a critical opportunity to use our voices, both as consumers and professionals, to demand stronger regulation on sustainability. This regulation can ensure that companies, claims, and products are genuinely green. They're backed by clear guidelines, transparency, and accountability. Only by doing so can we truly aim to achieve planetary health equity. That is, the equitable enjoyment of good health for all in a stable Earth system.